Mental health stigma is one of the biggest barriers preventing people from seeking help. This silent, powerful force affects individuals, families, and communities. The shame associated with mental health struggles often prevents people from reaching out for support. But breaking this stigma is not only possible, it's crucial for creating a society that prioritizes mental well-being. Why does stigma exist in the first place? One reason is the misunderstanding of mental health. Many still see mental illness as a personal weakness rather than a medical condition. This perception makes individuals feel ashamed or inadequate when they experience anxiety, depression, or other mental health challenges. It's time to change that narrative. Education is key in breaking down stigma. When people understand that mental health conditions are just as valid as physical health issues, they're less likely to judge. Educating yourself and others about mental health can go a long way in changing societal attitudes. It also empowers individuals to take action and seek the help they need. The media has played a significant role in perpetuating mental health stigma. Unrealistic portrayals of people with mental health disorders, often shown as violent or unpredictable, reinforce harmful stereotypes. By presenting accurate, empathetic representations, the media can help dispel these misconceptions. Positive portrayals of mental health challenges lead to greater understanding and acceptance. To break stigma, personal stories are powerful. Sharing experiences can help others feel understood and less isolated. When public figures and influencers talk openly about their own mental health struggles, they encourage others to do the same. These stories create a sense of solidarity, showing that mental health struggles don't define someone's worth. Another key aspect is language. Words like crazy, insane, or psycho contribute to the stigma. These labels reduce people to stereotypes, reinforcing the idea that they are less than others. Changing the way we talk about mental health by using neutral, respectful language helps create an environment where individuals feel safe seeking help. Promoting empathy is a central part of breaking mental health stigma. People are often afraid of what they don't understand. By encouraging open conversations and active listening, we can create a more empathetic society. When we listen without judgment, we provide a safe space for others to express their feelings and ask for support. In workplaces, schools, and communities, supportive environments are vital. Employers and educators must foster a culture where mental health is prioritized. Providing resources, like counseling or mental health days, ensures that people don't feel isolated when facing mental health challenges. A supportive environment encourages individuals to reach out when they need help. In families, mental health struggles are often overlooked or misunderstood. This lack of communication can create a barrier to seeking help. Families can reduce stigma by having open discussions about mental health and being supportive when someone needs care. When families openly support mental health, they provide the foundation for stronger, more connected relationships. Mental health stigma also affects decision-making. People may avoid pursuing their dreams or opportunities because they fear being judged for their mental health struggles. They may question their worth or feel unqualified due to the stigma attached to mental health. Breaking the stigma allows individuals to pursue their goals without fear of judgment or failure. The fear of being labeled as weak or broken prevents many people from seeking help. This fear makes them feel they must handle everything alone. It's essential to remember that seeking help is a sign of strength, not weakness. By normalizing help-seeking behavior, we make it easier for people to recognize when they need support and take action. Therapy and counseling are effective ways to address mental health challenges. However, the stigma surrounding therapy makes many hesitant to seek professional help. Encouraging people to view therapy as a normal, beneficial resource, just like going to a doctor for a physical ailment scan, help reduce the fear and shame associated with seeking help. It's important to emphasize that mental health struggles do not define a person. Someone's ability to function, achieve, and thrive isn't diminished by mental health conditions. Challenging the stigma around mental health means recognizing people for who they are, not just their mental health struggles. This shift in perspective helps reduce judgment and creates a more inclusive society. Access to care is another critical issue in breaking stigma. Even if someone is willing to seek help, lack of access to affordable mental health services can create another barrier. Advocating for better access to mental health services, whether through insurance, government support, or community initiatives, ensures that everyone has an opportunity to receive the care they deserve. In conclusion, breaking mental health stigma requires education, empathy, and advocacy. By changing the way we think and talk about mental health, we can create a world where seeking help is seen as a strength, not a weakness. Together, we can break the stigma and help people live healthier, more fulfilling lives. As we move toward breaking the stigma, it's crucial to remember that small actions lead to significant change. Every time we challenge the stereotypes and myths about mental health, we create a safer space for others. No effort is too small when it comes to promoting acceptance and understanding. So, what can you do today to make a difference? One of the most effective ways to break the stigma is by educating yourself and others about mental health. Understanding that mental health is just as important as physical health can help dismantle the misconceptions that fuel stigma. The more we educate ourselves, the more we can empathize with those who are struggling and offer meaningful support. Talking openly about mental health in casual conversations can have a profound impact. By speaking about it openly, we normalize the idea that it's okay to ask for help when needed. The more we discuss mental health issues, the less shame is attached to them. Over time, this helps create a culture where seeking help is seen as a brave and necessary action. Another impactful way to break the stigma is to be a compassionate listener. If someone opens up about their mental health struggles, don't dismiss their feelings. Listen without judgment and offer your support. Sometimes, just having someone to talk to makes all the difference. Active listening can create a sense of validation and connection, making it easier for the person to seek further help. Supporting mental health initiatives is another essential step. Whether it's donating to mental health organizations, volunteering, or advocating for policy changes, your support matters. Communities thrive when individuals come together to support mental health causes. By supporting these initiatives, we help amplify the message that mental health is a priority that needs attention and resources. If you're in a leadership position, whether in your workplace, school, or community, you have the power to set the tone for openness. Promote mental health awareness, provide access to resources, and encourage a non-judgmental culture. When people feel safe in these environments, they are more likely to seek help and talk about their struggles, knowing they won't be met with discrimination. Changing language around mental health is also essential. Avoid using negative terms like crazy or psycho to describe individuals with mental health conditions. Replace judgmental words with neutral, respectful language. This might seem like a small change, but it has a significant impact on how mental health is perceived. Language shapes attitudes, and positive language can foster understanding and empathy. One of the most powerful ways to reduce stigma is through sharing personal experiences. If you've struggled with your mental health, consider sharing your journey with others. Your story might encourage someone else who is silently suffering to seek help. By being open, you lead by example and show that there is no shame in asking for help. In addition to personal stories, public figures and influencers have a massive platform to challenge mental health stigma. When celebrities or influential figures speak openly about their own struggles, it sends a powerful message that mental health is a universal issue. This encourages their followers to rethink their perceptions and reduce the stigma associated with mental illness. Support from friends and family plays a critical role in breaking the stigma. When someone you care about shares their struggles, validate their feelings, and offer your unconditional support. Show them that seeking help is not only okay, but a sign of strength. The support you give can be life-changing, and it encourages them to take the steps toward healing and growth. It's also important to challenge stereotypes about what mental health conditions look like. Mental illness doesn't always look the way we might expect. Not everyone who struggles with mental health shows visible symptoms, and that's okay. It's important to realize that mental health issues don't discriminate, and anyone can experience them, regardless of their background, personality, or achievements. Creating an inclusive and supportive workplace culture is another powerful action to take. Workplaces should provide access to mental health resources, offer flexible leave for mental health reasons, and foster an environment where employees can openly discuss mental health without fear of repercussions. A mentally healthy workplace leads to more engaged, productive, and satisfied employees. Advocating for policy change can also make a significant impact. Governments, healthcare systems, and institutions need to prioritize mental health. By pushing for policy changes, we can ensure that mental health services are accessible, affordable, and effective. We can also work towards eliminating the discrimination that those with mental health conditions face in healthcare, the workplace, and society. On a societal level, we must work to reduce stigma in healthcare. Mental health services should be seen as essential, accessible care, not something to be ashamed of. This includes removing financial barriers to treatment, making therapy and counseling more available, and ensuring that insurance coverage is inclusive of mental health care. Another practical step is encouraging people to take care of their mental health, the same way they care for their physical health. Mental health maintenance should be normalized. Just as people go for routine physical checkups, they should feel comfortable seeking regular mental health check-ins. This prevention model helps people stay mentally healthy and catch issues before they become overwhelming. As we continue to break the stigma, we must remember that change takes time. Each conversation and each small act of kindness contributes to a larger cultural shift. By actively engaging in the process of destigmatizing mental health, we can create an environment where mental health is prioritized, openly discussed, and treated with respect and care. In conclusion, breaking the mental health stigma is not just an individual responsibility, but a societal one. The more we educate, support, and actively challenge the stigma, the easier it becomes for those affected by mental health struggles to seek help. By taking action today, we help create a world where mental health is seen as a vital part of overall well-being.